preterm labor is the labor that occurs in the period between the age of viability and the 37 weeks. Okay, so what is the age of viability? It is 24 weeks in most countries. So the labor in this period is preterm labor, because 37 week is the term. Okay, from 37 to 42 is the term. Okay, any labor in this period is between 37 and 42 is term labor. Between 24 and 37 is preterm labor, and before 24 it is an abortion. Okay, it is an abortion. So if we have a 36 plus, for example, 3 days pregnancy, then we have a preterm labor. Okay, preterm labor actually affect about 5 to 7% of all deliveries. Okay, and it is associated with high percentage of mortality and morbidity, about 50 to 70% with morbidity and mortality. We have what we call threatened preterm. A threatened preterm is a process of uterine contractions without cervical dilatation. As you know, if you have labor, then you have to have both contractions and dilatation. Okay, if we have no dilatation, just contractions, then it is a threatened preterm. Okay, not preterm labor. Now we told that 50 to 70% morbidity and mortality. Actually, about third of patients come with intact membrane in a preterm labor, and third of them with rupture membrane. So it is not just a preterm labor, but also preterm rupture of membrane. Okay, preterm prom, and third of them come with iatrogenic preterm labor. What do we mean by iatrogenic preterm labor? It is induction of labor in cases of PET, for example, and IUGR. These are the two most common causes of preterm iatrogenic labor. Okay, so third of them intact membrane, third ruptured membrane, spontaneous rupture, and third iatrogenic labor, induction of labor like in preeclampsia and IUGR. What are the causes and risk factors of preterm labor? I prefer to divide them into general causes. Okay, general causes, uterine causes, cervical causes, uteroplacental causes, social causes, fetal causes, and placental causes. Actually, there are many causes or risk factors of preterm labor, so subdividing them into these groups will make things easier. So let's start with the general causes of preterm labor. A previous preterm. If you have a preterm labor, this pregnancy, the next pregnancy will have a 15% risk ratio of having other preterm labor, and the second pregnancy will have 30%, and the third pregnancy will have 45%. Okay, so previous preterm is a risk factor for other preterm. Second term abortion also is a risk factor, and now some books say that first term abortion also is a risk factor, but is not proved until now. Okay, chromosomal abnormalities. As you know, chromosomal abnormalities is the most common cause of abortion. Okay, and also it is one of the causes of preterm labor. Okay, antepartum hemorrhage, like in abruption placenta, placenta previa, uterine rupture, and so on. Okay, asymptomatic bacteriuria. In the cases of infection, as I'll say in a minute, we will have a preterm labor in a lot of cases. Okay, and also in asymptomatic bacteriuria, we also will have preterm labor. It's a risk factor, preterm labor. Now let's move from general to uterine causes. Uterine causes like intrauterine infection, extrauterine infection, okay, over distension of the uterus, abnormalities of the uterus. Let's start with the intrauterine infections. Like what? The commonest infection is ascending infection. The commonest source of infections of the uterus is ascending infection from the vagina, bacterial vaginosis. And actually, this is the most common cause of preterm labor, bacterial vaginosis and intrauterine infection. Okay, so bacterial vaginosis and infection will lead to short cervix, and this is the underlying pathophysiology of preterm labor and infection. The intrauterine infection may also comes from the transplacenta, okay, transplacental infection, or from the tubes, transtubular infection, from the placenta, from the tube, or from the vagina. Vagina is the most common and most common cause of preterm labor. Also, extrauterine infection is a cause of preterm labor. Over distension of the uterus and stress on the walls of the uterus will cause also preterm labor. What are the causes of over distension of the uterus? Polyhydramnios and multiple gestation. These are the most important two. Okay, the most important two. Abnormalities of the uterus. Okay, so after the over distension, extrauterine infection and intrauterine infection, abnormalities of the uterus, like what? Like septate uterus, bicornuate uterus, and leiomyoma. These all are risk factors for preterm labor. Okay, so we've done from the general causes, the uterine causes. Now let's move to the cervical causes of preterm labor. Anything can cause cervical dilatation or disruption of the cervix anatomy. Surgeries will lead to preterm labor, like cervical incompetence. Cervical incompetence. Any cervical surgery is a risk factor of preterm labor. DNC, okay, this is a surgery. Previous cauterization and large loop biopsy. So all these are procedures that leads to disruption of the anatomy of the cervix, over dilatation of the cervix, and will lead to preterm labor. Cervical incompetence and preterm labor. Okay, so general uterus, cervix, and now the uteroplacental insufficiency, like in PET and IUGR. And the most common cause behind PET and IUGR in preterm labor is induction of labor. The treatment of PET and IUGR is to terminate the labor by induction of the labor, and in severe cases we terminate the labor or pregnancy pretermly. Okay, so that's why we have preterm labor and uteroplacental insufficiency. Now let's move to social causes of preterm labor. Any bad socio-economic status will lead or is a risk factor of preterm labor, like poverty, smoking, drugs, alcohol. Okay, and in a black race, some scientists say that a black race is by itself a risk factor of preterm labor, and others say that black you usually find poverty and smoking and drugs and alcohol, and that's why we have preterm labor. I don't know, but black is a risk factor for preterm labor. Body mass index below 19, extreme of age, okay, extremities below 20 and over 35. So these are easy to recall. Okay, black, poverty, smoking, drug, alcohol, extreme of age, body mass index. Okay, so now let's move to the fetal risk factors of preterm labor. Abruption of placenta. Oh, I'm sorry. These are the placental risk factor. Okay, fetal like IUGR or fetal anomalies. Okay, we said that the chromosomal abnormalities is a risk factor. So in other words, fetal anomaly also is a risk factor. IUGR is a risk factor. There are placental causes. Abruption placenta and placenta previa, and I mentioned them in uteroplacental insufficiency. Okay, now let's move to the symptoms of preterm labor. Actually, symptoms is a symptom of labor. You may have a pain, contractions, bleeding, okay, and sometimes you have a fluid. And when you have a gush of fluid, then it is not just a preterm labor, because preterm labor per se is not associated with leakage of fluid. But if you have a preterm premature rupture of membrane associated with preterm labor, then you will have fluid. Okay, so these are the risk factors of preterm labor. Remember them as general, social, fetal, then anatomy, uterus, cervix, uteroplacental insufficiency, placenta. Okay, and these are the symptoms. Symptoms: pain, bleeding, contractions, fluid just improve. Thank you very much for watching. In the next video, I'm going to talk about the diagnosis of preterm labor, history, physical examination, investigations, and the management of preterm labor. Thank you very much.